when you're in a crisis, as we are with the opioids still, you try everything. You hopefully find something that works. The episodic nature of Medicaid coverage, also can be a hindrance here with folks, suffering from addiction, for example. A significant population suffering this is incarcerated, which causes you to lose Medicaid benefits. And other with different states have their um, different eligibility criteria, and it's generally the nature of Medicaid that qualifying for the benefit is episodic. People come on, people come off, and for treating a lifetime problem such as addiction, this can be a real problem. I think the sense that we can build on, I think we had mentioned COVID, that there had been some relaxing of some rules in the Medicare program, in terms of getting home delivery of some medications, and relaxing some requirements on telehealth. Again, so as we do find ourselves in this continuing crisis, we could look to, I think, leverage, some of those opportunities, that, were created, under COVID, when new technology enters the marketplace, or new technology comes out of the laboratory to be available to patients. Then CMS, to its credit, does try to give access to those treatments through add-on payments, et cetera, et cetera. But again, with the use of central tendencies across a population, you have a pretty high variation, and at some points it's quite adequate. At others, it's not going to be.
This crisis isn't getting better, and in many ways we're seeing it get worse because the number of overdose deaths per year is increasing, partly fueled, I'm sure, by all the challenges of COVID and isolation. Part of the ways that we're able to address the local and regional challenges is allowing the communities to put forth their own activities and projects, try to be innovative where they can. A lot of our grantees, specifically around like the transportation and access issue, mobile units have been really popular amongst our grantees. So again, paired with telehealth, that's one way to get better, easier access to care throughout a larger geographic region, as opposed to having like one brick and mortar location. One example of really being able to meet a need that was identified to us was that we were hearing from our grantees that psychostimulants so our programs are focused largely on opioids just in those first few years. And our grantees were telling us, this is great, we really need this funding. But psychostimulants are really ravaging our communities, and we don't feel like we have the capacity to address psychostimulants. So we were able to create a program that allowed rural recipients to more specifically focus on psychostimulants. And that was at the same time that CDC data was telling us that the overdose death rates from psychostimulants were higher in rural communities than in urban communities. So we really, we keep a pulse on the research, the data, the needs of the communities, what our grantees are telling us. And often that allows us to then tailor programs or allow grantees to have that local and regionalized approach to addressing their challenges. Anything that removes barriers to access to care helps HRSA meet our goals and save lives. I think with better education to providers and to individuals, it's the same thing as like going in with a sore throat and the doctor's not always going to give you an antibiotic. Like not every sore throat needs an antibiotic. Not every ache and pain needs an opioid. There might be something better or safer to try. One other thing that is really important for anyone looking to address substance use disorder is so many communities, and it looks different everywhere, but stigma is a really important piece to address. And again, not something necessarily that the Support Act addresses, but finding ways to work in your community to educate individuals and address stigma so that it might tangentially then grow broader support for pieces of legislation like the Support Act, if we're educating people on why it's important. and the benefit that it has. If we see that something is working, we might build it into a future program or like more explicitly state that like grantees can do a certain thing. So innovation is really important in rural communities. Sustainability is another. Flexibility and sustainability are two of the key things that we want out of our programs. Our goal at the end of the day is we don't ever want a community who gets a grant to be dependent and reliant on that grant funding forever. We want them to be able to figure out how in their community they can then sustain those services, assuming that need continues.